Huntington's disease is a progressive brain condition, basically. So certain parts of the brain will be affected and they start to degenerate. Those changes will lead to some personality changes, some motor symptoms, and some cognitive impairment. It is a genetic disease, so that's why it runs in families, and a number of people in the family can be affected. If you have Huntington disease yourself, then your children will be at risk of developing the disease, and it's 50% risk of developing the illness. And there is a genetic test for that.
I think as a carer, when you first become a carer, you don't really realise you are. And I think it's important that you try and get as much help as you can from, say, the Huntington's Disease Association, from the neuropsychiatry department here, which are really helpful and provide lots of different types of support. One of the best advice that I was given many years ago when my husband was first diagnosed was to keep a diary. And that was probably the best advice I've ever had, because it allows you to look at what is happening, to write it down, and you feel better when you've written it down. And also, when someone says, oh, you've never told us that before, you can actually, you feel more that you've got a record of what you did say or what did happen. And so it makes it more of a partnership, working with the teams that are looking after the person that's ill. And also it is better for communications, because you can quite clearly say this happened on such and such a day, rather than trying to look back and say, well, did that happen, or was that before I saw the speech therapist, or after I saw the physiotherapist with my, the person you're looking after, and that sort of thing. I think we hope at the North Staffordshire branch of the Huntington's Disease Association, we meet monthly. We hope that we try and help people, invite people to come, and if they need any information, we'll always get in speakers or try our best to get the information. We also, I think as a carer, if someone says to you, do you want a carer's assessment, say yes, because you won't lose anything by getting it, and you might gain. And there are lots of things out there for carers, but it's not really seen at the very beginning.
In North Staffordshire, we have a generic neuropsychiatric services. In the context of that service, we have a Huntington disease service, whereby we'll be assessing patients from the time of diagnosis, and actually sometimes even before that, when they had a positive genetic testing. So we'll be seeing patients and try to support them depending on their needs, because it is an incurable condition, but equally there are a number of treatable aspects to this condition. We can treat patients in different settings, as in inpatients, outpatients. We see people in the community, at home, nursing homes, either doctors, therapists, nurses, and we would like to think that we offer a holistic approach to care, so we can see people and address all their needs, not just the medical bit, really.
My name is Jamie Lowe, and I'm an occupational therapist, and I work as part of the neuropsychiatric service in an interdisciplinary team. We're all specially interested in Huntington's disease. My role varies greatly based upon the individual and the individual's need. Typical support that I would offer would be around memory, planning, concentration strategies, and looking at safety and independence within a person's own home. Generally, assessment would be around the environment, meal preparation and personal hygiene, and all other activities of daily living. I would try to encourage and support the maintenance of a person's independence.
Yeah, if you just go nice and smoothly, that'd be lovely. Okay, just keep it going nice and smooth, great.
Hello, my name is Pam Weston-Clark. I'm a physiotherapist, and I form part of the multidisciplinary team here for the Huntington's disease service. As such, try initially to offer informal advice, discussion, so that people can access our service if they feel that it's the right time, if it's appropriate for them then. We offer advice regarding mobility, exercise, and it can be in a number of settings. One particularly is here at the day hospital, and we work both individually on exercise programs, but also we have a group that come together and exercise as a group, so it's a social setting, but also with the emphasis on that smooth control of movement, also incorporating breathing exercises so that we're very aware of both their effect on speech but also on swallowing and being safe. We can advise also regarding seating and the mobility aids alongside the other professions, occupational therapy and the community psychiatric nurses, so that really we should provide an all-round service as people wish and are ready to access this service.